Welcome to the Financial Flossing Podcast with Ross Brannon, guiding dental professionals to a brighter future. Ross Brannon is a financial advisor who knows it's not just about your teeth. He helps dental practice owners protect and maximize today's cash flow to plan for tomorrow's cash needs. Find him at rossbrannon.com. On the show, he brings together experts to help dental professionals looking to make smart money decisions to grow their income, turn their retirement goals into reality, and improve their lives. And now, here's your host, Ross Brannon.
Welcome to the show. Today, our guest is Rachel Wald. Rachel is the CEO and founder of Inspired Hygiene, a coaching firm focused on elevating hygiene services, systems, and profits. Inspired Hygiene strives to help dental teams achieve a triple win with healthier patients, empowered, engaged hygienists, and a profitable practice. She is an award-winning educator, author of the book Return on Hygiene, and has spent the last 30 years serving the industry as a clinical hygienist and hygiene productivity coach. Rachel, welcome to the show.
Thank you. Thanks, Ross, for having me.
So let me jump right in because I've interviewed other hygiene people before, but
okay.
I'm obviously not a dentist, and I'm a little confused because I'm 45 years old. I only have two cavities. I got them at 36 years old after a spout of bad eating. I was militant about never having it again. 9 out of 10 times I go to the dentist, they tell me my teeth look perfect. So when you talk about hygiene health, I'm always like, what is that? Because my gums are all in good shape because I'm psycho about my teeth. So explain to me, and obviously most of the people listening probably already know, but it's my show, so I get to ask the questions. Explain to me what is, good hygiene health.
So you're the patient, Ross, that we, see our schedule for the day and we're like, yes, Ross is coming in and he's coming in at 3:00. So we're going to get caught up because, Ross and I can connect pretty quickly on a personal level. His teeth are in great shape. He always does his home care. And then I'm going to be able to get out on time, at the end of the day. So you're the patient we look forward to seeing, and we look forward to seeing other patients too.
I'm just the easiest patient.
Yeah, you're the easiest patient of the day. So that's great. Congratulations. That's a good one thing you can check off of your things you have to kind of worry about in life maybe is you're doing what you need to do with your dental care. But as, if you have a lot of dental listeners, they know that that's not the majority of their patients probably. And I would say there are some demographics that maybe have more of those patients like you than others. And then there are some demographics that have more patients that are on the other end of the spectrum, right? That have a lot of dental problems and have a lot of dental needs. So the question I think you're asking is, what are some of those needs that we see as dental professionals that are very different than what you're experiencing?
I guess what I'm kind of confused with is if you're a dentist and the first line of defense is hygiene, everyone comes in to get a cleaning. And like you've said many times, hygiene is a lost leader, but there's so many opportunities to help somebody because gum disease is rampant. I've heard from numerous dentists that's the case. Why would we not turn this into a profitable division or a profitable silo of the practice? Because it sounds like there is tremendous opportunity to do so. It's not about making money. It's about serving the clients.
Right.
Because I would imagine that they tend to wait too long to diagnose things if they're reluctant to do hygiene the way you're going to promote hygiene.
Yes. So that's a great question. Why would you? Because I do not believe that hygiene is a loss leader. It is in some practices, right? Particularly in the last year or two when hygiene wages have gone up and reimbursements from third-party payers have gone down. We've seen some clients where, their hygiene is netting, $80 or $100 an hour, and they're paying their hygienist $50 an hour, and they have overhead to pay on that hygiene room. So it is a loss leader, but it shouldn't and does not have to be that way. So I would say to you, I agree. I'm with you in your confusion is why wouldn't you want to build the hygiene department into something that can be delivering high-level service, high-level care, engaging the hygienists that are within that department, and also creating profitability for the practice. And that's what we help our clients do. And it's very possible. And it can be at a lot of different levels, and it can be customized and tailored really to the dentist treatment philosophy. So I would say it doesn't have to be engaging with a hygiene consultant does not have to be a cookie cutter approach. Sometimes practices have had experience where, somebody comes in, they hired someone to do this, but okay, now you have to do it this, and this way in order to get this result. We take a slightly different approach, and we really try to take our proven processes, but tailor it to the practice, because you might have a dentist that's very proactive and they just have not had time to focus on the hygiene piece and they're ready to go with that. Or you may have a dentist that's more conservative, but they still recognize that we can be conservative and still diagnose disease, because sometimes super conservative can actually be like we're complacent and we're really ignoring this issue that's putting our practice at risk and is putting the patients at risk.
Well, let's step back for a second and let's tell me exactly what Inspired Hygiene does and how it came to be.
So we help dental practices, I would say mostly GP and periodontal practices, elevate the services that their hygienists are providing. So elevate patient care, create systems and processes that can be repeated by all of their team members and that create consistency and calibration. And all of that in turn increases the profitability that's coming from the hygiene department into the practice. And we came to be almost 20 years ago when I was a practicing hygienist and I saw what was happening in our practice with the help of a dental consultant. I was really interested in the ability of this individual to be able to come into our practice and help motivate the team, help put in processes so that we were all getting on the same page, and started working with her. And then she referred me to a hygiene coaching company, which I joined for a couple years. And then some things changed there. And so I decided to go out on my own and start Inspired Hygiene in 2004. And we've grown since then and been able to become one of the premier hygiene coaching companies in the United States. So it's been a fun ride.
So what do you see the average general dentist office doing in the hygiene department, and what should they consider doing instead?
Okay. So the average dental practice that we encounter, very often the dentist has taken a lot of clinical CE and they're delivering high level services. Maybe they're GPs placing implants, maybe they're doing smile designs, or they're offering lots of different, maybe specialty procedures in a GP practice. And they've been really focused on that from a dental perspective, but then hygiene has been left behind, right? Maybe they haven't focused on bringing hygiene to the same level as the dental providers are, the dentist providers are. And so what that looks like on a day-to-day basis might be very prophy heavy service mix. So the hygienists are primarily doing adult prophies and trying to address the disease that they're seeing in a procedure that really wasn't designed to do that. So they're either spending a lot of time on the scaling and trying to address, periodontal disease that they're seeing in localized areas. I think most teams are pretty good about, if it's just glaringly obvious periodontal disease, they'll get the patient either to a periodontist or they'll try to treat it themselves. But a lot of patients show up where it's isolated, and it could be an isolated, stage 1, stage 2, or 4 area, but they're trying to treat it in a prophy rather than identifying, diagnosing, and putting the patients into an appropriate, type of care where that hygienist actually has more time to address it much more thoroughly.
And so when you go in to help or consult with a practice, what does that look like?
So we have kind of a hybrid and on-site model. So hybrid, virtual and on-site model. And so we first work with the client. We gather some data from their hygiene department, and we do what's called a hygiene growth roadmap. So we actually help them see what's happening in the hygiene department, what is working really well, where are their strengths, and where are there areas that they have opportunities to grow from looking at their hygiene data. And we also look at the charts. We do a chart audit, we do a documentation audit within the hygiene department, and we put all this together and we give them some specific action steps. And then whether they decide to work with us to help them address those growth areas, or they want to do that on their own, right, is the next step of choice. If they choose to work with us, then one of our coaches comes into their practice, works with their team for 2 days, the whole team, and really helps them establish those clear standards of care, clear protocols, really getting everybody on the same page with not only how things are done, but why are they done? What is the belief system that we have to adopt to be able to execute on this and help patients say yes to treatment. And then we coach them virtually. So as they're implementing the things that they were taught on site, of course, the coach goes home and then the coach meets with them regularly virtually to see what's going well. What obstacles do you run into? How do we overcome and work through those? And then coach goes back again. And then now it's the next level. Okay, you've mastered this piece. Now we add to the next thing. And if it's perio, which still is the number one thing that we typically address with our clients, it may be initially refining a current perio program they have or helping them put in place something that they didn't have. And then the next step might be, okay, now let's apply some of those principles to how do we tee up treatment for the doctor and improve doctors' enrollment, case acceptance, because the hygienists are really pre-educating the patient. Or maybe now, how do we add adjunctive care to our perio program so that we can help patients get healthier? And then we go through that over the course of about a year, and then we have year 2 programs as well.
How important is to educate the client on oral health and gum disease? Because I would imagine most are pretty ignorant of it for the purposes of getting the care that's necessary or really needed.
So when you say client, the patient?
Yes, sorry. So when you say the patient,
that's okay.
When you're you're talking about the hygienist educating the patient on this, it seems like a really big deal because if they're not educated, I would assume they're reluctant by default, feeling like they're going to get sold something. But it's like, well, this is actually good for your health, like selling anything, if that makes sense.
Yeah, it does make sense. And I would say that in my experience, most hygienists are very good educators. So it's not for the lack of wanting to educate the patient or trying to share with the patient why they should brush and floss more or whatever it might be that would help them be healthier. The gap typically is, okay, we're having this conversation with the patient, they're not getting it. They're resistant, or we're trying to have this conversation with the patient, but we have no clear system of how do we move them from where they are now in care to the next level of care that's going to treat this disease, whether that is knowing which codes to use, having their business team on board so their business team understands where am I trying to take this patient and how do I need your support to present the financial piece of it? And so what we do is we help back up. Let's back up. So if we all understand that we're good educators, how can we maybe tweak the way that we're doing that in a way that gets the patient to want to say yes to the treatment and understand? And that comes to how we bring the patient alongside us in the diagnosis process. So that's one of the things that we teach is as a hygienist, instead of collecting all this information about the patient in silence, we're actually involving the patient in our diagnosis. So they're getting it. They're hearing, okay, Rachel, my hygienist just said, if I hear this and this, that means I may have active disease. And I'm hearing that. I'm hearing that she's saying bleeding. She's telling me my gum's bleeding. That's not good. And then also utilizing our technology, whether that's digital scanning, photos, the radiographic AI, whatever that is, to then back up that, show the patient the evidence of that. And then we've got to tie it into, why does the patient care? Like what have they already told us that is important to them that is affected by this disease process that they have?
You've got to create an emotional connection to get them motivated to do something. Yeah. So what is the success rate on getting the hygienists that you work with to make the improvements that you're going for?
It's extremely successful, and we have lots of case studies to show that. I would say it's very common and expected almost when we first start working with a practice for the hygienist to be hesitant and kind of, I would say, curious. I'll break it down this way. Let's say a third of the hygienists that we work with are super excited and they want this and they're ready to go. The other third are open but reluctant, right? And then the other third are resistant. And then I would say probably half of that final third we went over. So you're always still going to have a few that are, crossing their arms as they're listening to the conversation. I think they're resistant because maybe they make assumptions that, or maybe this had been approached to them in the past in a way that was maybe focused on production rather than on patient care. Maybe they assume that that's what it's about. It's all about selling patients things instead of it being about their overall health. Maybe they had a bad experience in the past with something that they tried and the patients rejected it and they don't want to go there. I mean, I'm making assumptions here, but that's what we've heard. Or maybe they don't see how could I fit one more thing into the time that I have, when what we really can do is teach them how to trade time that they're using and just do things in slightly different ways. So a great majority of those we're able to win over because we start with why. Why even try to, up level the care that you're providing? And why is that in the patient's best interest? That's where we start.
How long does it take to make this transition, if you will? And what typically do you see from a revenue standpoint the results are when this is done?
Okay. So, of course, there's a range, right? But I would say that our teams, because of the way that we set things up, we have them do some pre-work before the coach even comes in. And there are some relationship building opportunities before the coach comes in, because that all helps build trust. And it also helps anytime we're going to implement change. It's helpful if it's not like, we're going to flip the switch today and expect you to perform a different way tomorrow. That's not always the most successful way to do things. You've got to give folks time to kind of absorb and process what the change is, whether it is a change in verbal skill, whether it is a change in our treatment philosophy around this and how we're going to approach patients. So we give them some little bits of learning before their coach is ever in, so they have time to kind of wrap their mind around it. And because of that, typically within about 3 months of the coach being in their office, they're seeing dramatically different results.
Oh, wow. That's quicker than I thought.
I was just looking at a progress report from a client just a few minutes before we got on. And within their first 4 months, they went 3 quadrants of periotherapy being completed per month to 30 on average per month, and their hygiene production increasing by about 30%. And this is in a high PPO practice. So That's not unusual. I would say the range is probably anywhere from 3 to 10x increase on the amount of periotherapy, and then probably a 10 to 30%, maybe 35, even 40% range on production increase. And of course, you're going to have outliers on either end of that, but I feel confident with that range.
Wow. So what are some things that, as we kind of wind down here, what are some things that you would say that people are either misunderstanding about, changing the way they do hygiene, or some misconceptions in general about maybe a hygiene consultant? What are some of the kind of the things you've seen that, maybe a different perspective should be considered?
I think one of the misconceptions is that it's all about driving production and that there's some secret agenda with the doctor, right? As the hygiene consultant comes in of, okay, we've got to get them to XYZ production, and it's all everything drives towards that. I mean, certainly we are obligated to the practice owner. They're typically the ones that hire us, right? So they do have goals, and we want to help them achieve those goals, but we want to do that alongside the hygienist and be the hygienist advocate as well, and help them figure out, okay, so if these are the goals, how do we get there? How do we get there? And what are their goals as the hygienist? And are there things that they're frustrated with as well? And then we're also responsible to the patients, so that what we're teaching these teams to implement, now, while it's the doctor's ultimate responsibility, right, to set those standards of care, we're facilitating those processes of, all right, is what we're helping them put in place that they're going to be implementing on, Monday after we're there, is it ethical? Is it in the patient's best interest? Is it doable by the team? And is it going to help build not only the profitability of the practice, but the reputation of the practice, right? And also the mission and, vision of that practice, is it consistent there? So I think a misconception is that it's only about production and that it's short-lived. our goal really is to shift the mindset of the entire team more into a role of healthcare provider, because we're looking at all the aspects of the patient. It's not just perio, it's oral cancer screening, it's, restorative treatment, it's sleep apnea screening. Like, what are all of these things that the hygienist can bring to the table to help improve, all of the parties' experience?
Rachel, if people want to learn more about what you do or get in contact with you and talk with you about how you might be able to help them, how would they do that?
So our website is inspiredhygiene.com, and you'll see on the top there that you can book a free hygiene opportunity assessment. So what we do is we just collect a little bit of hygiene data from you, and our senior program advisor, Kim, puts together a presentation for you to share with you. Hey, here's what we see that's working well. Here's where we see you might have some opportunity and how we might be able to help. No obligation, but it's a very, I think, eye-opening. And we take it from a fairly conservative standpoint as well when we're presenting what those growth opportunities are. We're not trying to blow it out of the water. We're trying to give people realistic, achievable estimates on what we think that they can accomplish together working with us. So yeah, I would be happy to do, a free hygiene opportunity assessment with anyone.
And here's the last question. Like, what percentage of dental offices could make improvements in their hygiene?
100%.
Yeah.
Or I'll say, honestly, I think now with the technology that we have available, I would say 95 to 100%.
Wow. Well, this has been a very fascinating conversation. I'm glad that I am psycho about my teeth and gums, so I don't have.
I am too.
So, well, thank you so much for coming on today, Rachel.
Thank you, Ross.
You've been listening to the Financial Flossing Podcast with Ross Brannon.
This has been another episode of Financial Flossing with Ross Brannon, guiding dental professionals to a brighter future. If you liked what you heard, consider subscribing wherever you listen to podcasts. For more on Ross Brannon, visit rossbrannon.com.